They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you so much for joining us today for this episode of Being Well. I'm your host, Lacey Spence, and today we have a returning guest of the show. It's Dr. Amit Dande, and it's been a minute since you've been on the show, but welcome back.
Yes. Thank you. Thank you.
And so where are you located out of?
Well, right now I'm working in Decatur at St. Mary's Hospital, but I do have an office in Mattoon, and I come down twice a week to see the patients in this area that have heart or vascular problems.
And you said that is out of Prairie Cardiovascular?
Prairie Cardiovascular, yeah. We have offices in, I guess, we go to 120 different locations in the central and southern part of the state. So we have a lot of locations and a lot of heart doctors. So.
Gotcha. And since it's been a minute since you've been on the show, can you fill in maybe some of our newer viewers on why you got into medicine?
Yeah, that's a very long story, but I'll try to tell it in a short way. I was in just about to enter high school, and I had an uncle who was a doctor in a small town, and I went and spent the summer with him, and so I would just tag along with him, like doing whatever he was doing, and I really got to see close up, what medicine is all about, and it was revealing. It was very interesting. If you have a personality where you can absorb a lot of information, and then turn it around, and you have the personality to try to help people, then it's the perfect match. You have to have both parts of it. You have to be able to soak up a lot of information, hold it, and then apply it. And you have to have that mentality that you want to help somebody, because otherwise it's very, very hard. The people who survive and thrive in this field are the people who have a lot of empathy and can put yourself in the patient's shoes. And so turned out to be the right choice. And it wasn't easy. It's very hard to get into medical school in India, where I did my training, and much harder than here. And so I was able to get that. Then I transitioned here, and I did my training over here. And every step of the way, there's a process where you have to go through to get to the next level. A bunch of people are eliminated. So to become like a heart doctor is very competitive, and then to become a heart doctor who does stents is even more competitive. And so every step of the way, some people are eliminated. I mean, they become just regular heart doctors or something like that. Mm-hmm. But every step of the way, it adds a challenge and complexity. So I basically was very lucky, and a lot of hard work too, but luck plays a big role.
Well, we're sure glad that you persevered so that you can be here for me to kind of pick your brain today, that
Sure.
encyclopedia of knowledge.
Right.
And our topic today, heart and vascular disease.
Yeah.
So what is it?
So heart disease, everybody knows about heart attacks, and vascular disease is the counterpart. So heart and blood vessels are very intimately connected. The heart is connected to the organs with pipes, and that's what we call the blood vessels, or the vascular disease means diseases of the blood vessels. So everything leads to and from the heart. So the heart is the pump, the central point, and then the pipes carry the blood to the organs and bring it back. And if there's disease of the pipes, it directly affects the heart, and vice versa. So heart disease and vascular disease are very intimately related. For example, stroke is a disease of the blood vessels of the brain. And so we are finding out that a lot of people who have had a stroke in the past are also likely at high risk of having heart disease. And so that's how the relationship is being developed. Everything in the body is connected. And so people who are heart specialists are paying more attention to the vascular disease part as well, because if we just deal with the heart and leave everything alone, the rest of it for somebody else to manage, it turns out that's not the best for the patients.
So are we all kind of on a level playing field when it comes to heart disease, or is somebody, a certain group, more at risk than others?
Yeah, the typical risk factors for heart disease, if you have diabetes, for example, you're much more likely to get heart disease and vascular disease. Smokers get it sooner than other people. Age is the biggest risk factor. Everybody gets heart disease when you get older because the heart's a moving structure, continuous 24/7, it never stops. And so the older you are, the more the chances of having heart disease, but certain things make it come on sooner. So diabetes is one, smoking is one, being overweight is one. If you have a family history, that makes it more likely that you'll have the same thing that runs in your family. And those are the things we focus on: blood pressure, cholesterol. So those things add to your risk. So you might get disease sooner than later. People who don't have high blood pressure, don't have high cholesterol, don't have diabetes, we don't see them in our offices because they don't get heart disease until they're, quite older. And so the people that we meet in the offices, usually people who have high blood pressure, cholesterol, diabetes, smoking, family history. So those are the typical risk factors.
What about men versus women?
Yes, and women seem to lag behind men about 10 years, which is a good thing in this case. So men have heart attacks about 10 years sooner. There's been a lot of research in that area, and there's still ongoing research about why that is. Some of it is just women are different than men in terms of their body structure and other things. But some of it is just social factors. Women are more likely to seek medical help sooner. They don't ignore their symptoms in a lot of cases. So that plays a role in why we are able to catch things early, manage things better, and that's why we think that plays a role in why women present with disease later on, because their risk factors are better controlled in general.
And then is there also differences with ethnicity? Does that impact rates at all?
Yes, for sure. So that ties into the genetics. So certain classes of people are more likely to have heart disease. I know in India, where I'm from, the rates of rates of obesity are not as high as here, but the rates of diabetes are very high. And so the heart disease that develops over there is really more malignant than what we see over here. So there's definitely differences in different parts of the world. It depends on the prevalence of risk factors. It depends on the prevalence of things like, what kind of lifestyle are you leading? Are you more sedentary? For example, in the Western societies, we are seeing rising rates of obesity, which leads to rising rates of irregular heartbeat, something called atrial fibrillation and congestive heart failure and heart disease. And some of it is attributable to more sedentary lifestyle, more processed food in our diets. So we're sitting more, we're eating more, and not getting as much movement, and so that can sometimes overwhelm the genetics. So for example, there have been studies that show that people who are from India and have some family history of heart disease, there is a certain chance that they'll get heart disease. But when they come over to the United States and they adopt the Western diet, it accelerates a lot faster. So they get heart disease at a much younger age. So genetics plays a role, but the diet and lifestyle that we have here can overwhelm that. And you can do it the other way around. Just because you have a genetics or family history doesn't mean that you can't overcome that. So I have patients who have family members with heart disease, and when they adopt a different lifestyle, then they can put it off. They can delay it. And diet and lifestyle. I met somebody yesterday who is almost 70 years old and bikes like 40 miles a day. And his father had bypass surgery at 70, and this person is still pretty healthy. I don't think he will need the same kind of treatment as his father did. So you can push back against the genetics to a certain extent, but the main thing is awareness, and then following the right advice. There's a lot of misinformation out there too. So following the right person, the advice of a person that you trust, and somebody who knows what the latest literature says about preventing or delaying heart disease and vascular disease, that's really key.
That's kind of what I wanted to dive into next. I might not be hopping on a bike to go 40 miles or anything,
right.
But what do our preventative measures look like?
Yeah, so the main thing, the basics everybody knows. So a proper diet, which means a moderate amount of everything. You don't want to overdo on any one part of the diet. So too many carbohydrates are bad, too much fat is bad, too much salt is bad. So those habits are set very early in life. Unfortunately, the people that I meet, I will give them the talk, and then they will come back, and most of them, it's very hard for them to change their habits. People will sometimes pick up these fad diets and stuff, but I tell people, make the changes that you can live with, because the changes that I'm recommending are for the rest of your life. So it's maybe portion size. Eat what you like, but maybe not have the full piece of cake. Maybe have a smaller piece, and split it up into 2 pieces and share it with somebody or something like that. But diet plays a big role. Avoiding smoking, which in this area is still an issue. A lot of people still smoke, and a lot of people don't believe that it does harm. But I can see the changes in people who smoke. One of the things that I do is I take pictures. I put the dye into the body and see the blood vessels, what they look like from the inside. And ballpark, I can tell what decade a person is. Just looking at the pictures, not knowing anything else, I can tell this person looks like a picture of a 30-year-old or a 50-year-old or a 60-year-old. But the smokers, they always look on the inside, their blood vessels look like they're 20 years older than they are. So sometimes I show people in the office, they'll come to me and I'll show them their pictures. I'm like, this is not what we see. We're coming up with better techniques to do the same thing. We have something now called a calcium score, which we scan the heart and see if there's calcium built up in the blood vessels. Calcium follows the cholesterol, and we can kind of get an idea of how old your blood vessels are, which may not match up with your birthday. So if you do things like smoking or an unhealthy diet, or you have a genetic risk profile that's elevated, we can tell that your blood vessels are older than you are. So they're looking like somebody who is much older. So I saw somebody who is, for example, 33 years old, and he came to me with symptoms, and I thought it was his heart. And he didn't have insurance. So I said, well, get the calcium score. It's a cheap test, very, very easy to do. And turns out he has the calcium score that would be average for a 70-year-old. So he's only 33. So the person that is sitting in front of me is not a person that I should treat like a 33-year-old. I have to treat that person like he's a 70-year-old. So he went on a bunch of medicines for cholesterol, diabetes, and being overweight. I put him on some weight loss medications. And sure enough, he turned out to have blockages eventually when he got insurance, and we were able to patch up the areas that were really bad, and he feels better, he's doing okay, but that's some of the things that we're doing. But getting back to the question, proper diet, avoidance of toxins, I would say, like tobacco. Too much alcohol can damage the heart, for example. And proper sleep, that's another thing we're realizing, is a lot of people have problems with sleeping. Either they're not sleeping enough, or their sleep quality is not good. So I have been doing a lot of these tests where I put an oxygen sensor on the finger while you're sleeping, and that tells me if your oxygen is dropping at night. And a lot of people, as they get older, or if they've been smokers in the past or have COPD or lung problems, we will see a lot of oxygen dropping at night. And when the oxygen drops at night, your body panics and it kind of wakes up, and then you over time that adds up. Like if you've had a sleepless night in college, you know what it's like. The next day you're a zombie, you can't function. And so this is like adding up. It's not as bad as having a totally sleepless night, but your body's not getting the rest that it needs to function the next day, and it adds up over a few months or years. And people come to us, it's generally when they're pretty bad and they're falling asleep during the day, or some people get into traffic accidents and things like that. So but I try to check most people who give me any hint that they might have this condition. I try to check it early, so we can catch it early, we can prevent the problems that occur. So proper diet, exercise, and proper sleep. Those are the key for people who don't have heart disease, who want to prevent it.
What kind of remediation can you see if you are to stop smoking? I know that a lot of times a lot of the damage is already done,
right,
but there's still so much power in quitting when you can.
Yeah, that's true. That's very true. So smoking, there's a lot of research out there. We know exactly how it affects you. When you burn tobacco, there's about 2,000 harmful chemicals that are released. Most of them you don't want in your body. So they're working on cigarettes that would not do that. So they're working actually on cigarettes that are less addictive, and that would also, they're working on cigarettes that would not burn the tobacco, and it would heat it up. So you would get the flavor, but you wouldn't be putting as much chemicals. Now, it remains to be seen. Vaping was one of the things we thought would be safer, but turns out vaping is not that good either for your lungs. But to answer your question, the risk of having heart disease in a smoker is pretty high, but as soon as you stop, it starts to go down right away. So within about 48 hours of quitting smoking, the oxygen levels in your blood will start to improve. Sometimes I have people come in, and if somebody gets really sick, we take the blood directly and measure the oxygen levels. We don't do that routinely. We just measure a percentage number. That's a different number. Mm-hmm. But we take blood from the blood vessel and actually measure the oxygen. One of those results also gives you something called carbon monoxide, and people might know carbon monoxide is a poison. It's the stuff that comes out of the tailpipe in the car. So carbon monoxide is elevated in people who are smokers, and sometimes I will actually print it off and give it to them and say, this is your carbon monoxide level, and you can see that it's much higher than a normal person. Mm-hmm. So as soon as you stop smoking, those parameters start to normalize, and then after about a year, the risk of a heart attack is almost the same as somebody who's never smoked. So 1 year of quitting smoking puts you at a much lower risk of having heart attacks. Active smoking is what does it. Mm-hmm. And the risk of lung cancer, unfortunately, is still elevated for up to 10 years out, because cancer is a very slow growing process. So you might have the beginnings of something in there that the day you quit smoking, it will still grow because it's already started. And so we sometimes happen to catch it 4, 5, 10 years down the road. So the risk of lung cancer is elevated in smokers compared to non-smokers for up to 10 years out. But people feel better sometimes. Oftentimes I'll ask people, when they decide to quit on their own without me saying anything, and say, why did you quit? And people know this is, it was time. Their body starts to tell them that this is really making you sick. So there's a lot of research ongoing, and hopefully we'll have some better tools. Right now, nicotine addiction is very hard. Nicotine addiction is, I would say, I've treated people for a long time who've given up much worse, drugs and stuff, and they cannot quit the nicotine. So nicotine is a very powerful addictive substance. So if we can come up with something that will make it easier, I'm sure a lot of people want to quit. I mean, whenever I bring it up, a lot of people, there are a few people who will say, yeah, I'm not interested, I don't believe in all that, but there are a lot of people who would like to quit, but it's just so hard because the addiction is very powerful. But there's always new things coming down the road, and hopefully with a combination of things that are on the horizon, we should be able to make a dent in this problem in future.
Say, I've got a heart for that. Both my parents have smoked all my life, and I've watched them go back and forth with it for sure. So when it comes to heart and vascular disease, I know we've talked about a lot of preventative measures and things that will help when you're in that situation. Is it something you can completely cure, or is it something that you have to manage your whole life?
Yeah. So most of heart and vascular disease is just the aging process. Unless we come up with a magic bullet to turn back the clock, I tell people, everybody will get it. And that's why we need so many heart doctors and so many vascular specialists in the country. There's a big shortage of heart doctors and vascular specialists, because a lot of people are suffering through it and not knowing that there is a treatment or a cure available. So, but to answer your question, when it comes to a certain point, if it gets really bad, we have the tools to fix it, to bring you back to, get you back to your lifestyle, to let you do what you enjoy doing. Mm-hmm. So, for example, I know one patient I saw early on when I came here, and she just loved going dancing, and she couldn't do that anymore because her legs hurt all the time. And so she got sent to me. I saw that there was severe blockages, and we just fixed the problems, and she was so happy to get back to dancing. And as far as I know, she's still up. She's still doing that.
She's still dancing.
Still dancing. And so, whatever we like to do, either if it's something that interferes with your job, if you're a mailman or a mail carrier and you can't do that, we are more aggressive in trying to go in and fix the problem so that you can get back to doing what you enjoy doing. But for most other people whom either the problem is not that bad, or if it's something that is just a risk factor for them, then we just put them on medications to control it, to make sure that there's not enough, that it doesn't progress. So for example, if you have high cholesterol, and cholesterol is what plugs up the blood vessels on the inside, that's the commonest vascular problem. And if we keep you on cholesterol medicine so that blood doesn't have excess cholesterol, then it's less likely to clog up the arteries. And so you will have a longer time before it kicks in where it needs to be fixed. But there are fixes available for people who are really advanced. For most people, even if you get it fixed, we still have to manage the underlying conditions that caused the problem in the first place. So That depends on how bad the situation is and what do you want out of it.
If I'm not doing my regular checkups for my doctor to get labs to see what's going on the inside, how do I know what are my symptoms that I'm creeping into heart disease?
Well, so the commonest symptom is fatigue and shortness of breath, and certainly if you get any kind of chest symptoms like heaviness or tightness in your chest, that needs to be looked at. But it could be things like just having swelling of the legs, just having cramping of the calves when you walk. You can't walk very far. It hurts, in the back of the thigh or back of the calf when you walk. There is an association between different types of vascular disease and heart disease. For example, people with varicose veins, believe it or not, are more likely to have heart disease. It's not that you will definitely get it, but as a population, if I want to find everybody in town who has heart disease, then I look. The easiest way is to check the circulation in the toes. We have a test, very simple test, where we just check the circulation at the ankles and check the circulation in the arms. And so, if you have a difference, then you're already starting to develop some blockage because the blood is not getting to the toes, and the toes are farthest from the heart. So that's where we find it. So that can predict the chances of having a heart attack down the road. So that's one of the tools that I use because I do vascular and heart. As far as symptoms, like I said, tiredness, fatigue, poor quality sleep, not feeling refreshed when you wake up, those things can point towards the risk factor of having a sleeping problem that can turn into heart disease. If you're overweight, if you're struggling with trying to lose weight, you can't lose weight, something's not right. And obviously people who have underlying risk factors, the people who have high blood pressure, high cholesterol, diabetes, people who are smokers, have family members with heart disease at a young age, those people are much more likely to have heart disease and vascular disease. So if you have the risk factors, you should be aware. If you start to have any symptoms, and it could be very nonspecific, we have found that women have very different symptoms than men. So the typical crushing chest pain that people describe when they have a heart attack is a symptom, believe it or not, that men have. Women usually don't have that. Women will have symptoms that are very different. Sometimes it's not even in the chest. It may be in the neck or back that they have some discomfort. I have one patient, very interesting, that she told me, I didn't catch her, but when I saw her, she already had surgery, but she used to have pain only in the wrist. But it only happened when she walked. And that's the key. Exercise or walking or doing any activity makes your heart go harder and faster. And so if you have trouble doing those activities, then something's not right. Either the heart is not capable of keeping up with you, or something's off there. So she was having symptoms only when she walked, and it was only in the wrist, and her doctor was very smart, and he's like, you need to get your heart looked at. And sure enough, she needed open heart. She had severe blockages, and so she needed open heart surgery. But usually it's in the arm, left arm, shoulders, neck, back, any kind of discomfort like that, which is kind of new, and is associated with shortness of breath or being sweaty or nauseous. That is indicative of something going on.
It's kind of scary because it seems like a lot of those symptoms could be something else. So
right, and yeah, actually you're right, and a lot of people are. That's why we're trying to do more awareness, because people will. You don't want to think that you're having a heart attack, and so we're seeing rising rates of heart attacks in the younger people because older people are generally treated. You go to a doctor, they'll check your cholesterol, they'll put you on medicine. The number of heart attacks in the older population is actually declining. The number of heart attacks is half of what it used to be since when the statins came out. The statins are cholesterol medicines that are very effective in lowering cholesterol and also reducing heart attacks. So we're seeing far fewer heart attacks in the older population, and the heart attacks that happen are milder. But in the younger population, most of them are not aware they have heart disease. Most of them are not, like I said, rising rates of obesity and other risk factors. So we're seeing a lot of people that come in younger, and the commonest thing I hear is, I thought it was heartburn. I took some Tums, and then it didn't go away. And then, but the longer you delay, by the time you get to the hospital, the damage is done. If you get into the hospital as soon as it starts, we can salvage the heart, the heart muscle that was affected. But the longer you wait, the lack of oxygen just kills the heart muscle, and so then you're left with permanent damage. Then it turns into congestive heart failure down the road. So we are trying to raise awareness among the younger people that if it's something you've never had before, it's worth checking it out. And even if it's the middle of the night, most heart attacks happen unfortunately early morning hours. And people think, I'll just wait till in morning time, call my doctor. And it may not start off as bad symptoms, and it may start off as very mild stuff, but if you don't have heartburn and you didn't eat anything that would explain why you have heartburn, I would not put it off on heartburn, because just knowing what I know and seeing people every day, the commonest thing people do is just, oh, it's heartburn and I'm going to take some Tums and try to go back to sleep, and that's when the damage kicks in.
So that bottom line is, don't wait to talk to your doctor.
Most people, if they're being honest with themselves, they will know something's not right.
Mm-hmm.
So I have had this conversation numerous times with patients, and most people know something's wrong, but they don't want to believe it. So if you have symptoms that have never happened before, and this is something that you know in your heart of hearts that this is something new for you and it's something potentially serious, you should just not hesitate to call 911, because it could turn out to be nothing, but you want to be on top of this sort of thing. It's still the leading cause of death. It's 1 out of 4 heart attacks still end up with people not surviving to the hospital ride. So even if they come into the hospital, especially if people who are driving themselves, which is absolutely the worst thing to do, because many heart attacks lead to rhythm problems and you can pass out. And so if you're driving and you pass out, then you could damage the other person next to you who's so definitely don't drive yourself, but it's better to just get it checked out, and a lot of times the EMTs and stuff are trained to recognize these things. So if you call an ambulance, they get there 20 minutes, they check you out. If they don't feel it's bad enough, there needs to be something that needs to be evaluated in the hospital, there at least somebody who has some experience in the field has looked at it. So
sure.
So
well, great advice. Thank you so much for coming on today, and we hope that you will join us next time for our next episode of Being Well.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
They're the ones who raise the bar. The ones dedicated to providing care in the most demanding of circumstances. The ones that understand the healing benefits of kindness and compassion. They're the people of Sarah Bush Lincoln, and they set the bar high. Sarah Bush Lincoln, trusted, compassionate care right here close to home.